The reason they did so is because of possibly the statistic. Right now, 60 to 90% of all doctor visitations in at least North America are related to some stress-related condition. However, less than 10% of patients talk about stress to their physicians. So we have this interesting dichotomy where a lot of people are coming for stress, but we're not necessarily encouraged to talk a lot about stress. And again, if we come back and talk about Ayurveda, we'll explain where that divide happens. It's pretty interesting in terms of how history kind of delved away from mind body. Now, in the allopathic world, how we handle stress looks a lot like this. We sedate them, right? We knock them out until next week. And we do that a lot here as well. You know, I've used my fair share of GABA. You know, I've used my fair share of things that kind of calm the neurotransmitters of the brain to try and kind of unplug. But the problem with this direction over long term, of course, is they wake up eventually. And now we have to give them something to get on with life. So you end up with this roller coaster ride of sedatives to excitatories to stimulants and back again. So although this is an interesting avenue and certainly does work, we can also consider other strategies as well. So let's really quickly talk about the stress response system, and we'll just briefly do that. We'll do a longer version of this tonight for those of you who have customers in your department that want to talk about this later on. The mind truly does have an influence on the entire body, and particularly in terms of stress. Stress causes the body to go into an alert phase that prevents it or that protects itself through the avenues of inflammation. Inflammation is the result of stress. Stress causes the body to go into a defensive posture, and that defensive posture is inflammation, right? Now, in the drug side of the world, right, they don't use the word anti-inflammatory. They would laugh you out if you said anti-inflammatory in the drug world. What they call it is immunosuppressants. Isn't that amazing? All anti-inflammatories are immunosuppressants, because who's making inflammation? The immune system's making inflammation. Stress isn't causing it to happen. You know, on the flight over, you know, they have the televisions on the planes now, which is amazing. But I don't know how they do that even, but they have these televisions on there, and there's what, 4 or 5 news channels available. And on every one of those news channels is a commercials for what? Life insurance. $50,000 policy will get you $350,000 when you die. Like all these fear-based kind of mentality, all these drug advertisements, all this fear that's constantly being fed into the body. And what the body does to protect from fear is inflammation. And what we give people is anti-inflammatories, immunosuppressants. Now, Ayurveda says you can approach this concept with anti-inflammatories. That's certainly an idea. But another idea would be to treat the mind, to not be as sensitive to stress, as sensitive to emotions, as volatile to those $50,000 commercials on life insurance. You know, they said that's another strategy to consider. The way we do it again here in the West is to give everyone a lot of fish oil. Now, don't get me wrong, I use a lot of fish oil. I dispense a lot of fish oil. I take a lot of fish oil. But I don't expect fish oil to stop my mind from reacting to those commercials on CNN. Does that make sense? So when you go out and talk to someone about fish oil, ask them about stress. Ask how much stress they have in their life. And it's an interesting dynamic you'll notice. When I talk to males about stress, what do they say? I'm fine. And so then you have to ask the male, how's work going? And they go, I want to kill my boss. We have a very divorced way of talking about stress. So find creative ways to ask about stress, you know? Find creative ways and you'll start opening the door to have a conversation about adaptogens, about rasayanas, about herbs that again lower our reaction to stress. And that's truly another goal to consider besides simply those non-inflammatory hormones that can be dosed so well now because of the advent of digital. What we consider to add to this would be stress care. And stress care is like the multivitamin for us. Everyone who walks in will walk out with a stress care formulation because everyone's dealing with stress and not everyone's really good about talking about it. This is a major formulation that's been around since the 1970s. So there's been over 30 years worth of research and experience with this. In Europe, stress care, which is called Geriforte, as in gerontological, because in Ayurveda, as you get older, you get more fearful. And that also happens as we age. We get kind of nervous about what's happening in the world or what's happening with our children, et cetera, et cetera, et cetera. So Geriforte is the name for it in other ways. This product is co-prescribed with Prozac. They put it together in other countries. And we'll talk about why they put it together as we review the clinical trial. So this was a clinical trial on stress care. This was done back in 2009, 2010. I repeat this a lot for those of you who've been to my lecture because this is a very impressive finding in my opinion. But this was done with patients with major depression. All of these patients, there were 50 in this particular trial, all of them had attempted suicide in the last 6 weeks. These were all patients involved in a psychiatric hospital setting. They had access to emergency medicine and emergency counseling. So we did have a placebo arm, but it was passed by ethics. In the 6 weeks of the study, we found 82% of them said they had better duration of sleep and less complaints of insomnia. This is a major category of understanding in Ayurveda. In Ayurveda, they look at the clock, very much like we have here. They said fear is most prominent between 9 p.m. and 12 p.m. They said that's when fear becomes very active, or vata becomes very active. And when you talk to people who can't get to sleep, you say, why can't you go to sleep? And they'll say, what? I'm stuck in my head. I can't stop thinking. Or worse, they're watching television, which is what? Vata. It's energy, it's motion, it's movement, it's creativity, it's thought, and they can't stop their mind from moving. Does that make sense? So seeing people get to sleep better, that's an indication that the mind is sedating itself from, or guarding itself from those aspects of fear or vata influences in their mind. Does that make sense? By the way, midnight to 3 a.m. is pitta. Pitta is anger. Which, so you start off the night being worried that you can't go to sleep, and then by midnight, what? You're pissed because you can't go to sleep. Right now, you're getting angry. So why can't I go to sleep? You know, you can watch the doshas kind of move around, and by 3 or 4 o'clock in the morning, you're catatonic, and you're like, that's kapha, right? Kapha is the solid stone, the water there, and that's why it's so hard to wake up at that point, because now you're stuck in this kapha plate. You can finally go to bed, but now you can't wake out of that. So even insomnia, people can't get to sleep, people who can't stay asleep, people that can't wake up, you would treat them differently in Ayurveda. This is a vata condition. This is a pitta condition. This is a kapha condition on the clock, right? So now you have multiple directions to go in with plants. It's a wonderful way of looking at the plant world. Anyway, 82% better resolution in terms of insomnia. 85% had reductions in morning fatigue. This is called hypersomnia in the West. This relates to depression directly. Depression shows up as not being able to wake up. These are the people that have 2 alarm clocks set, and then they hit snooze 12 times apiece, right? That means the adrenals aren't showing up to work on time. That means their mind isn't excited about the potential for the day. This is hypersomnia. It's very correlated with depression. So now we have the depressive side of insomniatics, right, or sleep disorders, being improved by 85% versus 19 in the placebo. I forgot to go over this one on placebo. 20% in placebo, 82 in the stress care group. 63% of them said they had better energy in the middle of the day. I guess standing on a cliff is not good for a suicide study. I don't know why this big thing. I just thought of that when I put it in. Sorry about that, everybody. 63% said they had better energy in the middle of the day versus 5% in the placebo group. This relates to blood sugar anomalies. Stress causes sugar to be dumped in the blood, and then the brain tells the pancreas to stop making insulin. And it does so that we can keep the brain bathed in sugar, because the brain only runs on sugar. That's the only fuel of the brain. The brain is largely made out of fat, yes, but it only uses sugar for energy. The brain consumes 1/3 of all your calories just in operating. Even if you were in a coma, it would still consume about 1/4 to 1/3 of all your calories. Okay? The brain also has no way of storing sugar. So the only way it can get sugar in the blood is by telling the pancreas to either produce glucagon or insulin. And that's how the brain is going to react. That's why we're addicted to CNN and HLN and all the news channels, because everything that stresses us out is a sugar high. And that's why there's a Starbucks every 5 feet, because stress is a sugar high. And the more we get stressed, the more we get rewarded with sugar, and it all goes back in a circle. What do we know about sugar? It's a shard of glass in the blood. So the more sugar you have in the blood, the more inflammation you have in the blood. Now we talked about that. Inflammation is a good thing in stress because it's trying to protect you. But again, if the stressors are emotional, not physical, then all this inflammation goes in the wrong way, right? So again, we look for middle of the day fatigue, or middle of the day kind of like, what do they call it? Kind of slumps in the day. We look for that to be a sign that there could be some sugar conditions we want to look into. So this is another great number to consider versus 5% in the placebo group. 60% reductions in self-reported feelings of worthlessness. So here we are starting to lean towards the emotional, psychological side of this condition versus 8% in the placebo group. And 79% had a reduction in self-reported thoughts of suicide or suicidal ideations versus 9% in the placebo group. Here where we start to see a greater divide between what we can expect from the anti-inflammatory immunosuppressant side and what we can see from the rasayana, from the adaptogenic side, from the idea of increasing the will to live. Because in Ayurveda, your first promise in practice is treat the will to live. That is your first promise in Ayurveda. That's a major goal for them, and that's why their formulations have so much promise in terms of quality of life. So really quickly on the summary of stress care, there's 72 ingredients in there. It's a big formula, but again, they spend most of their time thinking of the mind and formulating for the mind. I will tell you this, if you show a formula to a customer and 72 ingredients makes them stressed out, don't use it. Don't give them a product that makes them more stressed out, right? Go for those single herbs. That's where the single herbs will come in handy, or the single ingredients, L-theanine, right? All those have options for people as well. Think about it as you go, but watch their reactions. Always kind of play along with how they feel about it. But you can talk about some of the herbs that are more popular for them. Ashwagandha, right? Holy basil, saffron. These are all part. Chyawanprash, which is in the back, which some of you are tasting. That's in stress care. That's our multivitamin in Ayurveda. All of those can be called out very quickly, so at least they have a better understanding of how this formulation works. Overall, we've done over 170 clinical trials on the Geraforte and stress care formulations. So a lot of wonderful data that we can kind of approach and learn more about its effectiveness out there. We do know it reduces cortisol levels. That last study that we just reviewed reduced cortisol by 10% or 10 points. The reason I don't focus on that is because cortisol doesn't tell me if you're thinking of suicide. I don't focus a lot on cortisol because that's a blood chemistry work. That doesn't tell me how you're feeling. I can give you licorice today, and tomorrow your cortisol levels will change because of licorice, but that doesn't mean you're feeling happier. Does that make sense? We have to balance blood chemistry with quality of life. You know, I've seen a lot of the statistics on statin drug use, right, on cholesterol. There's some people in the morgue who have the best cholesterol you'll ever see, right, but they're still dead. So treating the blood work still doesn't mean we have longevity. So look at both ends of the spectrum. Again, promotes normal sleep patterns, and again, reduces midday fatigue, which is again a great one to approach in terms of what do you have good for energy. This is not a cure-all for all fatigue, but it's certainly one of the steps that Ayurveda said to begin with. Begin with the mind, and then move your way to digestion. Yes.
How long was that study, and what was the dosage on it?
6 weeks, 2 caps twice a day. The studies are performed before the product is released so that we know what to put on the back of the bottle. So all of the bottles will have what the clinical trials found was successful. And that's why there's variations in the dosages from bottle to bottle to bottle. We also study if you take it before a meal, with a meal, after a meal. We do different studies to figure out what was the best potency, which reduced the most GI upset. And that's why we'll put it on the bottle as well. Good question. Any other questions? No? We're running, we have about 10 minutes left, we have 15 minutes left, so we'll run really quickly. I use this a lot when people say I'm feeling slow, worn out, adrenal burnout. A good symptom to look for in adrenal burnout is no appetite in the morning. Cortisol should show up an hour after waking up, and cortisol's first job is to make you hungry because one of our older stresses was starvation. So cortisol's job is to make you eat. That's why some people who get nervous do what? They go for the potato chips, they go for the pretzels, because cortisol is telling them that the stressor is probably starvation, right? So you might want to start packing up the pounds now in the event that this continues. So, but if the adrenal doesn't wake up for its job, if it calls in sick in the morning because you've burned through it watching CNN on a flight all night, right? Then you're not going to be hungry in the morning. So that's a really interesting kind of way. Just start asking, how's the appetite in the morning? And then people will usually say, you know, I haven't been hungry lately in the morning. And that's a great indication that this might be a consideration for them. Some people who want just more time or more quality out of their workouts, you know. The body doesn't know the difference between working out and getting hit by a car. To the body, it's the same thing. So it's inflammation, and it treats it like stress. It doesn't know why you're running on that treadmill. It just knows you're running really fast. And something's probably, what? Chasing you. So it's going to create inflammation as it responds to that, you know. I forgot to work out at the hotel this morning, which makes 9 years in a row now. I think it's a habit. I think I should stop. Anyway, you want more out of life. Then people say, I come home from work and I'm just mentally exhausted. I don't have anything to give to the family when I get home. that's a great consideration for something like stress care, for these rasayanas that rejuvenate, again, the emotional side of our being so that we can approach life with a little more vigor and tenacity. I try and bring a lot of quotes because clinical trials are very, they're aseptic. We don't really see a lot of their faces or hear their words, but I do try and drag out a couple people. This is Mrs. Emmerich. Emmerich did give permission, of course, to use this information, but she's been on stress care for 6 weeks now. She said, I'm feeling young again. My anger is gone too. I'm not depressed anymore. I'm very calm now. Now my dreams are beautiful. I've stopped crying. I got out of seclusion and I'm joining senior activities again. I feel like a girl again. Now, she's 87 years of age. This is very common to what we expect to see in practice. And remember, what are the 3 poisons? Anger, fear, right? Desire, anger, sadness, fear. All of those elements start to show up in their conversation. And you can really see the wisdom that this tradition really bestowed upon the world. So what if the customers that I have that come to my store are never exposed to any kind of stress and are generally pretty happy people? Wow, you found Buddha, right? You found him. He's just walking in your store. Let's start a religion really quickly and let's all take off our shoes. It's hard for me to believe that, because we live in a very stressful world in our time. But if they don't want to talk about it, that's fine. If you want to talk about stress, great. If you have Mind Care is like Stress Care Junior, and it doesn't say stress on the bottom. So you can switch them over to Mind Care, and they're still on a stress product without having to know they're on a stress product. So a lot of people, they're like, I don't have any stress at all. I don't have any problem. Okay, got it. So you support digestion next. Traditionally, we use trifle and trica-2. They asked me to talk about turmeric, so I will talk about how turmeric affects it in terms of how we use it, which is for digestion and, of course, liver care. And we'll go quickly. So are you ready for the hottest thing on the planet? It's the sun. The sun is the hottest thing on the planet. It's a massive source of radiation. It's constantly burning everything up. If you ever visit the South or go to Texas, all the billboards are totally not visible because the sun's totally bleached everything out. Plants, of course, have had to evolve with this massive source of radiation, and they have to gain energy from it, but they also have to protect themselves from it. And of course, we see that both here, both the protection and the potential of obviously these chlorophyll and the chloroplast producing cells, they are producing the conversion from energy in form of sunlight into sugar. And so they've created this really unique way because they can't wear a hat and they can't turn on an umbrella. They can't run away from the sun, so they have to find a way to make peace with this destructive force. The protective side of this element isn't seen until the winter, when the water escapes from the leaves of the plant, and the reason it's doing that is because when the water freezes, it shrinks and the cells will crack and break, and now you don't have a leaf anymore. So the energy of the plant will move to the roots where the temperature is more consistent, right? And what's left behind are the protective devices of the plant that are absorbing all the radiation from the sun, and we call these oligomeric proanthocyanidins, or resveratrol. That's primarily what it is. What happened? Okay. These are the antioxidants. You don't see them because chlorophyll covers it, right? The brighter a plant, the brighter the ingredient, the more potential it has to absorb radiation. That's why you eat the rainbow, right? That's why you have as many fruits and vegetables on your plate, because the more color you have on your plate, the more antioxidants you have. And all the antioxidants are named after the color, right? So soy isoflavones, flavos in Greek means yellow. It's the yellow part of the soybean because color absorbs radiation. Does that make sense? Anthocyanidins, like we talked about, cyan, right, is the blue-purple color that we paint with. So it's the purple in grapes that makes wine medicinal. That's why red wine is medicinal and white wine is not, because it's the color that has the potential for antioxidants, for anti-inflammatory, for radiation. It's all the same word, by the way. They're not different. In fact, in travels, for those of you who've been around to the equator, the closer they get to the sun, the more bright their colors become in their clothing. In India, Guatemala, Belize, right? They start wearing the colors in the way that our fruits and vegetables do. It's pretty dynamic to kind of see how nature has nothing to do with what we're doing. In terms of plant potential and color, you won't see anything as vibrant as turmeric. Turmeric has an amazing coloration. It does fade as time goes away. So if you go to a grocery store and you see turmeric, if it's very pale yellow, they usually start off very dynamic and they just lose it with oxidation. As they absorb free radicals from the outside world, they lose that potential. These are a dynamic antioxidant and unequaled, I believe, in the herb world. I don't care about ORAC values very much. ORAC, by the way, was created for testing frozen foods to figure out how long you can preserve for frozen foods. It wasn't meant for us biologically. It's interesting, but it's not the end-all be-all. I do believe turmeric is a fascinating plant and a lot of potential in terms of its antioxidant potential. Now recently, I've had a lot of people ask me, wait a minute, the studies are saying turmeric is not absorbable, so henceforth it doesn't work. So I did turn around and I burned all my Ayurveda books. This is a 5,000 to 10,000 year system here, and to say that it didn't work because your study said it didn't go through the bowels very well, I still say there's something to think about and something to consider. And I will give you the perspective that Ayurveda gave to it. The current science is saying that curcuminoids have poor bioavailability. They're measuring that from plasma. They do blood draws within 24 hours taking turmeric, and they see very negligible curves in the blood work. In other words, it's not coming through the intestinal wall. The fecal tests, which I'm glad I'm not involved with that study, right? You collect the fecal matter and you measure it. About 98% of it comes out in the fecal matter, very similar to the way it came in. So it comes in and out, and because it doesn't get in the blood, it probably has no promise for the human system. I don't think that's true. How many people have heard of flax lignans? What are flax lignans known for? Anti-inflammatory and what? Phytoestrogenic, in particular breast cancer. That's the most promising aspect of flax lignans. But what are flax lignans? They are non-ingestible fibers. They come in the mouth and they come out the same way. What we understand their potential to be is it changes the flora of the gut. And since 70% of the immune system is active here, you can affect the immune system by what? Changing the gut. So in the drug world, we're very curious about what receptor site fits into this, lock and key, blah, blah, blah. In Ayurveda, they're talking about pharmacokinetics. What does this domino cause downstream? And can we do something here that affects something over here and not have to use big drugs to do it? That's their perspective. So let's look at it really quickly. Turmeric has been used for IBS, IBD, rheumatoid arthritis, osteoarthritis, skin conditions, cancer, infections, and jaundice. This is not just in India, but in Europe as well. So this was Ayurveda in traditional Chinese medicine and in Culpeper, which is the European eclectic physicians. They all used it for hepatitis. So here we have an ingredient that has a tremendous amount of history of use, even though the data is saying it's not bioavailable. If curcuminoids don't pass the gut, what if the changes occur in the gut? And that's my question in terms of where we can go in the stemming of research. We are going in this direction with Himalaya. In fact, we're seeing really interesting things with the turmeric enema right now, which I won't go into. But anyway, what are the concurrent conditions to IBD? Now, IBD is irritable bowel disease. Irritable bowel disease means you don't have cancer. It's a dead-end diagnosis. It means we don't know what's wrong with you, but at least you don't have cancer, so you have IBD. Medicine does that a lot. Have you ever heard of PMS? That's a dead-end diagnosis. There are over 200 symptoms associated with PMS, right? So picking a bad lottery number is a part of PMS now, right? It's like anything that they can't understand, they throw into the PMS thing. IBD is the exact same way. It just means you don't have cancer, essentially. If you have IBD, your likelihood of getting any or all of these goes up fourfold. Asthma, psoriasis, type 1 diabetes, rheumatoid arthritis, multiple sclerosis, systemic lupus, vitiligo, Graves, Hashimoto's, and I gave an extra parenthetical, I have no idea, chronic glomerulonephritis, kidney disease. In other words, where there's inflammation in the gut, the system can become what? Inflammatory altogether. And that's what Ayurveda said turmeric was good for, was calming down the inflammation in the small intestines. And that makes a lot of sense because the food that you're digesting is covered in acids, right? It's a food bolus, and when it falls in the intestines, it has to be met with a pool of alkaline bile coming from the liver. And if that doesn't happen, that acid ball falls in the intestinal wall, and it what? Corrodes and erodes the small intestine because the liver is not working on the timeliness of delivering bile. In other words, we consume food, it creates bloating, right? Painful digestion. People eat a little bit of food and everything starts to bloat them out, and then they become what? Sensitive to certain foods, weak, gluten. How many people know about gluten intolerance, right? Ask those people with gluten intolerance, is that the only thing you're sensitive to? And they go, oh no, I can't eat oats, I can't eat apples, I can't eat licorice, I can't eat... So it's not just gluten, it's an inflammatory small intestine environment that's making everything slowly sensitive. So heal the gut, and we follow the process, go to the mind, go to the gut, and we have a little more interesting directions to consider. So, I'll skip through this because we're running out of time. We did our study on turmeric, non-ingestible forms of turmeric, just regular water and supercritical extracted turmeric, on patients between the ages of 40 to 80 with radiological evidence of osteoarthritis at the knee along with the hip and the joints. The radiological evidence was confirmed by the presence of osteophytes, marginal lipping, narrowing of the joint space, sclerotic articular margins, and pain reports. So it wasn't just me saying, oh, my knee hurts. It was x-rays that proved and documented these people had osteoarthritis. They were divided into placebo and into an active drug group. Joint pain scores dropped by 95% in 3 months. Joint stiffness fell by 87% in 3 months. This is a picture of my life, by the way. And again, the last thing I'll say about turmeric is a massive amount of chemistry here. I don't believe curcuminoids are the only answer to this. If curcuminoids don't have a lot of bioavailability, there's still a lot of really interesting chemistry here on the HPLC that we have not yet looked into as far as its synergy with curcuminoids or even as an isolate. And that could also be part of the picture. Turmerones being one of the particular ones that are very interesting to say. So again, there's a lot of, I think there's a lot of great turmerics out there. I don't think that the end of the conversation is just bioavailability. I'm not daunted by that in case it comes up in a conversation. I think the bioavailable and the non-bioavailable, both of them have real potential in the industry, one way or the other. Any questions on that? Otherwise, it is 8:55, so I ran out of time. Any questions? We didn't get to liver care, so I'll really quickly on liver care. Liver care has been around since 1955. We have over 270 clinical trials on liver care in LIV52. It was formulated by Himalayas' first female medical director, who was hired in 1950. And I like that because I've only worked for one female medical director in the West, and that was in the last 6 years. So for them to hire a female medical director in 1950 in India, it talks a little about this family, you know what I mean? It is a massive successful formulation in the industry. In Switzerland, it is an approved drug for prescription. That's how potent the clinical trials have been on that particular formulation. Liver care is particularly for the functions of the liver. The liver has over 500 jobs, one of which is detox. So we tend to focus on detox, and that's like saying my car is a great place to store change, right? It's like saying just one thing of the potential of this. So we do like liver care for all of those functions of the liver versus just detoxification. I don't want to abuse everyone's time, so I'll make sure I say it. Anything else we can cover, or I'm done? Any other quickly?
Prostate care.
Oh, prostate care. Okay, so in prostate issues, really quickly, DHT, does everyone know DHT, dihydrotestosterone, right? That's the culprit in terms of prostate issues. DHT peaks twice in male physiology. Once in utero, in the first trimester, to assign the sex to the ovary. Oh my God, can you imagine? I have a male ovary, gosh, I can't keep up with them. Once to assign the gender to the egg, right? And then it goes away. And then it comes back a second time during adolescence. And that stimulates secondary sex gland growth, right? So the hair comes out, the voice gets deeper, right? The hair follicles get stimulated, right? The prostate starts to grow, the testes start to grow, all the things that initiate male, and then it goes away again. It doesn't come back again until benign prostatic hypertrophy or prostate issues. A lot of the drug direction in the Western allopathic world is to focus on DHT. Ayurveda says, why did DHT show up again? Our working theory is estrogen. Estrogen is challenging the testosterone levels in males as they get older. If testosterone was the problem with prostate issues, then we'd have 15-year-old boys with prostate issues, not 50-year-old men with prostate issues. Testosterone peaks in youth, not in adulthood. But because men are succumbing to the same estrogen load, xenoestrogens, that females are seeing it in the reproductive organs for them, right? The breast and the reproductive organs. Males is the same thing. We're seeing it happening to our prostate because estrogen's creeping up, and the male says, wait a minute, that's not my job. I was supposed to be male, not female. And the only thing it can do is reduce testosterone into the more aggressive dihydrotestosterone. And then we have prostate issues. So the way we approach it is, one, increase free testosterone through tribulus terrestis. And that's that's traditional way Ayurveda did it. And secondly, remove excess estrogen from the liver. And that's what the prostate care formulation does. Prostate care formulation is the only one in our industry that reduces not only the size of the prostate as measured by sonogram, but also reduces PSA scores. So we haven't seen that happen in the natural industry yet. So to see both PSA go down and the prostate size, that means we're reducing the likelihood of cancer long term. And that's pretty promising as well. And that